Pets have more love and compassion in them than most humans. One of the biggest social crises facing our world in general and our seniors, in particular, is loneliness. While online communications like Zoom and Skype are thriving, we seem to have lost the human touch. For many seniors, the idea of this new technology is beyond their grasp, and they grapple with the debilitating effects of loneliness and isolation every day. For ailing seniors, many are housebound and struggling with their health issues alone. Could a pet offer some relief? Our company, Signal Health Group, will be happy to offer advice. What is pet therapy? Pet therapy is quite simply the unconditional love and friendship that pet ownership or any interaction with animals can provide. Owning a pet offers companionship and friendship. A pet can improve one's quality of life while giving purpose to every day. There is no underestimating the healing powers of owning a pet. It is, therefore, understandably that many healthcare practitioners are recruiting the services of therapy animals to supplement allopathic treatment. A brief history of pet therapy. The well-known nurse Florence Nightingale is noted with stating in 1859 that a small pet animal is often an excellent companion for the sick. She observed the positive effects a visiting cat or dog had on her patients. Greek physicians, Hippocrates and Galen, realized the healing effects of animals. They used pet therapy to treat the mentally ill and depressed. In 1940, the American Red Cross introduced pets to lift the spirits of recuperating war veterans. Pet therapy took their minds off the horrors of war that they had experienced. It helped them to focus more on their recovery. In the 1960s, psychologist Boris Levinson first coined the term pet therapy when he noticed the beneficial effects his dog, Jingles, had on one of his patients. This event led him to research the interactions between animals and humans. Even the renowned neurologist Dr. Sigmund Freud had his dog Joe Phi in his treatment room as he believed Joe Phi had a calming effect on his patients. The positive effects of owning a pet on seniors. Gives meaning and purpose to one's day. Feeding and caring for your pet reduces boredom and gives your day structure. Can increase exercise and boost energy levels. Increases one's mobility. Can lead to socializing, meeting other pet owners at the park. A general feeling of happiness, smiling more, and seeing life more positively. Take one's mind of their aches and pains. It's well documented that chronic pain has its origin in the brain. Pets can take the focus off the pain. An overwhelming feeling of love releases the feel-good hormones. A reduction in depressive feelings and anxiety. Loving a pet can lower blood pressure and the risk of heart disease. Increase one's self-esteem and confidence. Reduce the feelings of loneliness. Increase that warm and fuzzy feeling. Wanting to project warmth and caring. Provide emotional support. Keep you laughing. Pets do the funniest things. Offer affection and unconditional love. Cuddling your pet releases the love hormone oxytocin. This hormone causes positive emotional states. Fewer visits to the doctor and fewer medications. Owning your pet. Of course, owning your pet is preferable. If you are still active and live independently, pet ownership is the best option for all the reasons mentioned above. If you're fit and active to go out walking with your dog and exploring nature together, this has even more benefits. Walking your dog can also lead to new friendships and socializing. Your day will have more purpose and routine with feeding times and walk times. Your dog will not let you forget those. He will probably nudge you out of bed in the mornings. Which pet is suitable for you? Owning a pet means having responsibilities for the adequate care of your pet. Dogs probably are the most demanding of your time and energy, but the rewards are worth it. Dogs need regular exercise. The larger the dog, the more walking it will need. This factor is an important consideration when choosing the size and breed of your dog. Are you active enough to take your dog for daily walks? Are you capable of handling the feeding, grooming, and playtime with your dog? Everyone loves a puppy, but again, one needs to consider the special needs of puppies. While puppies do sleep a lot, when they are awake, they are very active. Training the puppy can also be challenging, and dealing with little accidents can be extra work and frustration. Also, considering one's age, your puppy may outlive you, and then there is the problem of who will care for your dog when you are gone. Cats sleep around 15 hours a day. This makes cats a perfect low-maintenance pet for the less mobile senior. Cats still offer companionship and friendship but don't have the same needs as a dog. Your cat will be happy sitting on your lap, sleeping on your bed, and joining you as you soak up the sun in the garden. Visiting pets. Of course, not all seniors can own a pet. Illness, declining mobility, dementia are some of the reasons a senior may now be living in an assisted care home, hospice, retirement home, or hospital. However, this doesn't mean that one has to forego the healing benefits of pets. Many associations assist by bringing therapy dogs to the senior. These visits can be a source of great excitement and something for the senior to look forward to. Research has shown that only 15 minutes with a pet is enough to release the feel-good hormones of oxytocin and serotonin. Animal-assisted therapy. Depending on the medical condition, a senior patient may be prescribed animal-assisted therapy, a therapeutic intervention that introduces animals into the treatment plan to complement the traditional treatments. Though dogs are the primary animal used, other animals such as horses and dolphins may also be employed. In conclusion, there is no denying the positive effects of owning a pet. In regards to seniors, pet ownership could be even more important. A companion to bring joy and happiness and improve one's quality of life. For those living far away from family and loved ones, and for those that have no family, a pet can fulfill those emotional needs for connection and love. A pet is a lifelong friend that offers unconditional love always. Our company, Signal Health Group, is unique in that our focus is to care for loved ones the same way their family would. We advocate for our low-income elderly and veteran to make sure they have access to quality care. In-home care is a more affordable option for families compared to nursing homes and assisted living facilities. Having us in-home services makes it easier for families to ensure their senior loved ones get the help they need while staying within their budget. If you require skilled care, can turn to Signal Health Group. All of our non-skilled, hospice and skilled nursing care services are provided by experienced healthcare professionals who know how to provide medical care inside seniors' homes. Hospice care at home is also another close-to-heart service Signal Health Group provides for the last stage of life. Many Signal Health Group's services are covered by Medicare, Medicaid, insurance, private pay, and/or VA programs. If you're searching for personal care services, home health services or hospice services, reach out to our agencies throughout the U.S. to discuss the costs, as well as the coverage you may receive from your current health insurance providers. We would be happy to help you stay safe, healthy, and comfortable in your home for as long as possible. For those who are interested in business opportunities, Signal Health Group is a franchise. With the number of older individuals growing every single day, choosing to run a home care agency is a wise idea. Learn more about our services offered across the United States and business opportunities at signalhg.com.